When a woman wants to have a child, it seems like the smiling, cooing faces of babies are everywhere, and everyone around her is pregnant.
I'm 34. I'll be 35 this year. We've been married for almost 5 years, and we've been trying for about 3.5, 4 years now.
Christine Luong and her husband Nin are no different from the 1 in 6 American couples who are having trouble conceiving.
But after thinking, why me, you come to find there's a lot of other women who are going through it.
Dr. Maher Abdallah sees between 30 and 40 new patients a month at his new clinic in Palm Springs. It is the only place in the Coachella Valley patients like the Luongs can receive in vitro fertilization, the complicated, expensive, and most effective last resort for many couples.
We extract the eggs out from the ovary. We inject the sperm into the egg, and we form an embryo in the incubator. And we allow it to grow for 5 days. And then we transfer the embryo into the uterus.
Prior to the opening of American Reproductive Centers, couples in the Valley had to drive to Loma Linda, Los Angeles, Orange County, or San Diego for IVF.
When you're going through the medication process, you're here up to 2-3 times a week. And that's a lot of travel. So whoever decides to go through this process has to really commit themselves to taking the time.
We're serving a population of roughly 450,000 people. How is there only one reproductive specialist in our valley?
Most people think this is an older, retired community, when in fact the fastest rising population is the young population.
Dr. Abdallah's patients range in age from their mid-20s to well past age 40.
So it appears to be there are a lot of misconceptions about women and fertility and the age in which they can naturally conceive.
The odds are really slim at age 43 and 44, even with in vitro fertilization.
And the births of so many multiples to aging Hollywood mothers isn't helping.
And what's missing from all those stories is that the patients most commonly used an egg donor who's usually 21 or 22 years of age.
The reality is that after age 40, conception often occurs in a lab like Abdallah's. But the difference, at least lately, and the reason he's been so successful in getting women pregnant, is a new breakthrough in embryonic testing.
We can look at embryos that look perfect like this, and they're not genetically normal.
Abdallah and his embryologist Susan Smith can test a couple's embryos pre-implantation to make sure there are no chromosomal abnormalities.
The most common reason why women miscarry is because the embryo is not genetically normal. So we exclude Down syndrome and other anomalies before the pregnancy even happens.
The Luongs decided to go through with genetic testing when they went through their first cycle of in vitro.
I just had to be thankful for genetic testing, because had we not done genetic testing, the doctor would have transferred those embryos, and he said most likely I would have miscarried. And it just saved us a lot of heartache and sadness.
Earlier this month, Luong and her husband started their second cycle of IVF treatment.
It's a huge risk that you take going in through IVF, because there is no guarantee that you will get pregnant.
But she dreams of one day sharing some good news with her family.
I know for sure my dad would be overjoyed. He's been wanting grandkids forever. I know that it'd be just this genuine happiness for all of us.